So yeah, welcome everyone to our webinar on My Health, My Data Act. Today we're going to talk about what this new law, which has come from Washington, is about. A lot has changed since then as well. There have been more states who have passed these laws. There has been a broad change on how US states are looking at health data, consumer health data, and the corresponding regulations. So we're going to talk about that. We're going to talk about the scope, what is consumer health data as well. And with that, we can start. So again, welcome everyone. I am going to be today's host and moderator. My name is Vaibhav. I also go by V. I'm the founder and CEO of Privado. Privado helps companies comply with privacy laws by scanning the product's code and giving you visibility into what data you collect, what data you share, who you share it with, and where it flows inside your company. With me is Mohsin. Mohsin, why don't you introduce yourself as well?
Hi, everyone. My name is Mohsin Khatn. I'm a privacy SME who's found a niche enjoying privacy work. I've worked in healthcare companies all my career, and I'm excited to talk a little bit more about Washington's approach.
Awesome. Thanks, Mohsin, for joining. When we were kind of building the panel, it was super exciting to kind of brainstorm with you on ideas on, okay, where has the law becomes too broad, or where does the industry think of it, or how is it going to impact? So I'm pretty stoked about that. And quickly, again, from an agenda perspective, we're going to first touch upon the law itself, but also like overall how things are changing in US from a regulatory perspective. There have been multiple actions by the FTC and also multiple states passing their own versions of My Health, My Data. We'll of course touch about the My Health, My Data. I think we'll spend a lot of time on defining what consumer health data is, some broad definitions of that as well. And then we'll go into like what the requirements are and how can you comply. If time permits, we'll also give you a quick demo of Privado and how we can help you with the same, and then open it up for Q&A. Awesome. So yeah, I think one of the things that we've been seeing, and I think this is our third webinar specific to health that we've done as Privado, is the overall shift as far as US is concerned on consumer health data. And I think like kind of the starting point was back in June 2022, when the Roe versus Wade case was overturned. And after that, we've seen like multiple guidance coming in from FTC, from the White House, HHS, and then the regulatory action itself has changed a lot. A lot of fines on companies like Better Health, GoodRx, and continuous focus by FTC, and then eventually by states like Washington, which passed My Health, My Data law as well. So I think from what we are seeing is it's not happening, or this law itself is not in vacuum, but overall there has been conditions or regulatory actions by both the regulator like FTC, and hence there is an overall move to protecting consumer health data, right? So Mohsin, would love to kind of hear from you in terms of what do you feel about that, in terms of how do you see as a practitioner all these laws coming up or the regulatory action, and if you can also touch about how to prepare, especially in such fragmented conditions where each state is passing their own law, and what's your approach?
Yeah, so I think one of the key areas to remember is that, traditionally healthcare data has been kept in one subset for covered entities. And with the advent of, consumers being more aware of their health and being, searching, and more devices being available, there's been a generation of data that's been not traditionally held in healthcare, but healthcare quasi, your period tracking apps, your Fitbit devices, Apple devices, all these sensors, while they're not falling under HIPAA, these are falling under healthcare, but without those protections. And what you're seeing really is a rise of consumer awareness, regulatory action, as well as political action around how do we protect and react to that information that is out there? Because again, these are influencing behaviors, as well as could potentially lead to certain detrimental decisions or actions in that context. If there was ever a, need of somebody looking at somebody else's information around healthcare, you wouldn't necessarily need to follow HIPAA if they were using one of these other devices. And that's where all of these regulations are coming from. The note, though, I'd like to point out is that the FTC's had this rule around for a while, or a similar rule in this context that does protect all these consumer health related data. And the the sad part is that they've not traditionally been enforcing or acting upon it, but that existing rule has been there. And if you look at these regulatory actions that you see in various different states, they carry some flavor of it. However, because of what happened in Roe, and you see that fallout really in Washington, is that there is a political impetus to act and enforce these regulatory frameworks in somewhat of an expedited manner. Washington's been trying for a number of years to have some sort of privacy law passed, and it's failed for various different reasons. Yet all of a sudden, because of this being passed, it kind of sped up. And that leads to sometimes laws that are not fully thought out of, and being sometimes overly broad or having unintended consequences that conflict with other guidances around the states. Washington, California, Connecticut, Virginia, they all have different regulatory frameworks on some certain aspect that at times can conflict with each other. And it's difficult to balance that without having to essentially become an expert on what data you're collecting from where, as well as where it's being stored, and also under what context it is if you're not a non-healthcare company.
Yeah, actually, that's a great point, right? Like the point that the framework was there, and FTC kind of is really enforcing it after a while, and
Right.
And also like what Washington did. I mean, I was surprised that essentially the updated law for Connecticut is basically they added the health portion, and that's going live from 1st of July. So that leaves kind of no room for even interpretations. You have to really jump into action and start doing. So, I mean, if that's something that you were preparing for, this is an added layer of something that you might not thought of as well.
Absolutely. And I think one of the things to also remember is that while the law is passed and is being enforced, guidances around the law are unavailable, really. There's no AG action that has kind of provided any specific guidances on how the enforcement is going to be taken. And the other thing is, you also have to remember, these laws also have a private right of action that has traditionally not been available in healthcare organizations, as well as some FTC that was not available in the past. So there is going to be plaintiff attorneys, as well as other venues which will be pushing the limit on the interpretation of laws, and you will have judicial interpretation which may conflict. And it'll be interesting to see what that entails in that context, because again, you're going to have a number of cases, not right now, but start popping up relatively soon around these, because people are more aware of their rights, as well as what they perceive to be their rights, and they would like to respond to them. I've had people outside of California try to take it, claim that they fall within the California CCPA, CPRA exemptions or coverage, and have those applied to them. And it's always interesting to have to walk them through that. Sorry, you live in Florida, doesn't always work that way.
That makes complete sense. And kind of like what we're also seeing, right? Like if you look at the My Health, My Data, it's just kind of linking to your point. It's basically the shift from going from only regulated entities to protecting overall consumer health data, which could be data which is being generated by all the apps which have digitized. It could be a telehealth app, it could be app for meditation, it could be your fitness devices, right? So all of these devices, these apps are kind of collecting a lot of health data. A lot of it can be used to have real life physical harms. And this law is essentially kind of building that up in the sense, hey, kind of giving the same protection that a kind of a HIPAA regulated entity had in the past, right? So I think that's kind of, from a consumer standpoint, it's kind of very interesting, and it's kind of expected as well. And I think one thing that I found really interested was how the legal bases were thought of in My Health, My Data Act. And a lot of it was around consent, etc. Right? So we'd love to kind of get your view on that, Mohsin, and also about selling and sharing. That when CPRA or CCPA came in, that was also a broad discussion. So if you can touch about the legal basis and what is selling, what is sharing, that would be super helpful.
Yeah, absolutely. So stepping back, looking at what the law is really about, is it's a response to, in a way, to the Roe decision around protecting, or at least it was politically sold as a response to that, around protecting consumer data that targets certain services around reproductive health. However, it's been overly broad in the context of who it impacts. It captures a wide range of entities and consumers, including any entity really doing business in Washington or that's being provided to services that are targeting in the state of Washington. And again, targeted is not defined, so it's going to be a wide interpretation. We're going to have to see what judicial or regulatory guidance is on that. So it's going to be very interesting to see next couple of months when they start really to kind of narrow it down in that context once enforcement as well as guidances start coming out. The good thing, however, for some entities is if you're already regulated around a privacy framework, you know, in the US, GLBA, FCRA, FERPA, HIPAA, those are generally enumerated exemptions in that context. So while them and their specific business associates might have carve-outs, you're leading to a broader enforcement applicability for actions for entities that are not traditionally been familiar with regards to privacy. So say you're a pharmacy, you're providing consumer health information. We'll talk a little bit about what that means. You could potentially be impacted in this context and be applicable in that area.
That makes sense. And in terms of like selling or sharing of data, what are your thoughts about that? I mean, how is the law looking at selling/sharing?
So that is a great question. So under sale, it's a little bit more onerous with regards to CCPA, CPRA. So if you thought CCPA, CPRA was a little conflicted and a little tough, it's going to be harder in this context. It's really around a restriction on and a prohibition on any activity that would constitute a sale to including nearly all third parties. And you're seeing more of a subject access and right here in that context, as well as, you know, when we talk about deletion, very little avenues for business to use or certain cases in that context. So very little exceptions available in that area. So for sale, I would say you're looking at a tougher interpretation around using specifically as well as targeted advertising in that context.
Yeah, that makes complete sense. So I mean, like, again, like as we get closer and we get more guidance, you know, these things will shape up. But like looking at the full third-party ecosystem becomes super important, you know, like because that is definitely known. You know what the third parties you end up integrating with. And then yeah, as it becomes more defined in terms of selling, sharing, and your processors, then yeah, you can change the obligation slightly differently, but at least getting to a place will be super important. So I think super helpful.
I think, yeah, you raise a great point around third parties in this context, because again, let's be quite honest, you know, every organization does engage third parties in one form or another to assist with certain services. Whether you're healthcare, outside of healthcare in that context, very few have dedicated, can handle all of their internal use cases for third parties. So when we are sharing information, we have to be very cognizant of what information we're sharing, especially in this context, because again, you're looking at two different kind of avenues of regulations around individual access and rights, because again, they're going to be able to pursue those rights to know who you're sharing that with. So knowing what you're sharing with whom is also one of those important aspects, as well as, you know, making sure that when they exercise their right of deletion, you're able to confirm that with your sub vendors in that context.
Makes sense. And yeah, I think as I was going through the law, I think the part that's going to puzzle people the most is the definition of what constitutes consumer health data, correct? And I mean, it's defined in a very specific way. And as we were chatting, preparing for the webinar, you know, we were discussing, hey, it's kind of super broad. And, you know, this is different from state to state, you know, even the classification as you were telling, but it pretty much defines it as like any, you know, kind of, if you have like an identifier which can link to an individual, and then if that links is to anything which can anything related to a physical or mental health status. And the interesting part that I found there was it could also be derived. So it could be like you can combine some data sets, and that could basically help you identify or make a connection to a physical or mental health of any individual. Then all of that becomes consumer health data. So Mohsin, would love to get a perspective from you, essentially, like as we were chatting, it's super broad. How would you present that, or how do you define your interpretation of consumer health data as it's coming?
Well, I mean, I wouldn't interpret it as my definition. I'd interpret it as what the regulatory framework has written down as, and that's kind of also where, you know, we're looking at the fact that right now there's no guidance on what they're going to be enforcing. So our only interpretation is really what the intent was, as well as, you know, what was written in the law in this context. And as it says right now, it's extremely broad and open-ended. You know, it starts with a general definition of what is linked or could reasonably be linked to a consumer and identifies the consumer past or future, like you were saying, mental or health status. And that could be any number of items, including, you know, you're looking at, hey, am I searching for diabetes in a pharmacy, right? All of a sudden, guess what? If you're flagging and you're collecting information, well, that's theoretically and is actually being located to that. Or if you're advocating for, say, here are, these, I'm running a volunteer clinic and it's open to everybody in the community. We're not collecting anything. It's every open-ended. Well, I mean, if somebody signs up and says, what are your illnesses or what would you like to talk about? All of a sudden you say, oh, I have, mental health issues, or I'd like to provide, you could potentially have certain impacts in that context. Now, there's always carve-outs for HIPAA and those, but again, those applicabilities apply under certain contexts. So you have to be careful in that area. Genetic data is another huge one. We collect 23andMe, and as well as a few others in that context. And once you start collecting all of that information, there is use case scenarios that some are permitted, again, around de-identified data in that context, but others, you're running into this very narrow area. And, I can use maps features as well that list out clinics. And once you start searching for it and a profile starts getting built, well, all of a sudden we're looking at, tangentially related items, and any private attorney could try to make an attempted link. Now, this may not always fly, absolutely, but these are potential links in that context that could potentially be there.
Yeah, makes sense. And like sometimes it's just the way these applications or products will get built. And this will be an afterthought. So for example, what you were saying, if someone is reading on diabetes and that page itself has that link, and if that is going, because the way these analytics tools are built, they take away all the URLs. The URL has the linkage of the disease to that person, and suddenly you have consumer health data because you have the individual, and then you have in the URL of the page things like diabetes or you're just reading, but that constitutes consumer health data, right? So like smartly architecting, or it'll be a lot of re-architecting as well of how your products, applications, websites are being built as well. So yeah, as we kind of go next, we do wanted to make sure we give you like a high level view of what all data categories are, and I'm sure like people who are on the webinar, you must have seen them. So there's the general health data, targeting things like health conditions, diagnosis, diagnostic testing, medication. So yeah, I mean, if someone and that's like an interesting question, right? Like, hey, so if someone is buying medicine for diabetes, for sure, that's consumer health data. But then what about if someone is buying a Band-Aid, or wound care? So is that really consumer health data or not? So yeah, some of these questions I'm hoping we get more clarity. But yeah, so that's the general health data. You have health related data, so that's typically your procedures, bodily function. So probably even things like BMI typically can be part of that. I think gender affirming care information, reproductive or sexual health information, these have been defined really well. So I think this will be the known. I would say the general health data, that could be some unknowns, but some of them are like pretty pointed. Then there's your biometric and genetic data, as Mohsin was saying. Precise location, I think that was something, when I was reading it, I was kind of like thinking and I was kind of confused. So Mohsin, in terms of precise location, it like almost all apps have precise location. If I use a ride sharing app today, I'm going to end a trip, and I can end a trip to a hospital as well. So what does this really mean? I mean, like precise location in this context.
Yeah, and the precise location really is a key aspect of what this response was really about, is, anything data that could reasonably indicate a consumer's attempt to acquire or receive a service. So this was really, where the hospitals, where the reproductive health services located, and how are we, utilizing that information to target, non-target them. And also, by the way, just a tangential mention, California's got a new law where it's banning the use of reverse keyword searches and reverse location technology to protect privacy of individuals who are seeking abortion. So it's not just Washington. Other states are also looking at different ways of approaching this. But when we talk about precise location, if they're going to a doctor, if they're going to a mental health clinic, if they're going to a number of these, there is a reasonable basis to believe that this person is seeking care. And when we're talking about that kind of aspect, we're looking at the fact that, there's an argument to be made that there is a consumer health data in that context. Now, admittedly, there's also an argument to be made that it isn't. However, because the structure of the law is so broad and their interpretation as present is so broad, it would behoove us to be a little bit more cautious because, again, the safety as well as the requirements under the law, both because of regulatory action and private action interpretation, are there in that context. So for your example of, say you're using an Uber or Lyft or any of the ride sharing device services, one day you're searching for, I want to go to the hospital. You could just be visiting somebody, but because again, the way it's structured, technically that would fall within this line and would be available in that aspect. There's lots of companies that build profiles on individuals and where they visit, where they go. You might be working at a location, but it also might be the fact that you're there for care and you're running into those aspects in that area. And that's kind of a key aspect of it.
So yeah, I mean, basically what I'm hearing, and which makes a lot of sense, is precise location should be looked carefully, especially the context, so the use of it. And I would say, like, if it gets shared, then especially to any data brokers or ad tech players, then you don't really have any control. So that becomes something to be to definitely look at.
Absolutely. And that goes to your earlier comment, well, two earlier comments on knowing who you're sharing with and where you're sharing it, as well as your comment around, when you're designing these systems, this is something that you need to kind of keep in mind in the context of the information you're collecting, information you're sharing, and what regulatory frameworks apply in that context.
Awesome. And then, as we were preparing for this webinar, what I did was I did a quick use of two telehealth apps for either to get like a weight loss medicine or building a nutrition plan. So they had the same standard pattern. Essentially, you would fill an intake form and they will suggest, so they're trying to rank. And within 5 minutes of interacting with these services, I was able to figure out, hey, a lot of consumer health data as defined by these laws were being collected. Some examples. So the basic one, they dropped a cookie, IP, pixels. So that itself became the first thing because they linked me to that telehealth app. Then there were questions about pregnancy status, BMI, do I have diabetes, blood pressure, am I facing depression, and also like diagnosis around bulimia or anorexia, right? So, and this is just maybe 5 minutes of it. So what my sense of running this small experiment was, I mean, a lot of medical apps which were not traditionally, as Mohsin, you were mentioning, part of HIPAA and they were left out, there will be a lot of impact for them. And they could be a solo developer or they could be a large company, but going back and looking at all these input forms and collection points and then figuring out what all is consumer health data will become super important.
No, absolutely.
And with that, we have a small poll that I'm going to launch. So yeah, so for people who are on the webinar, would love to get some answers in. And again, what we're trying to do is like a broad definition of consumer health data. So trying to see if what would you consider as consumer health data given the option. So, and yeah, again, not really like anything could be right or wrong here. As we were chatting in the webinar. Okay, so you're getting a lot of answers already. I'll just give it another 10 seconds and then 10, 20 seconds and we can move on. So if you can see the poll, please please put in your answers. Yep, I think 5 more seconds and I'll end the poll. So yeah, if you can see pretty much a lot of people voted all of the above. And again, like no right or wrong answers we learned, but in my opinion, that's the right answer. Purchase data for grocery app, it seems it should not be consumer health data, but I'm going to make up a scenario where it could be. So the broadest possible way is what it could enable is you could literally see a pattern of certain purchases and then say, and I think there was a popular I think it broke out news at some place where you could essentially combine the grocery purchase and then predict on the back end by doing analytics and machine learning, hey, is this person pregnant or not, right? Or you could also like look at purchases around the type of milk and say, hey, this person has allergies of milk, right? So again, it depends on the context. So I wouldn't say like by default, purchase data for grocery app can be consumer health data. But if you use it to create categories around like allergens and things like those, it could definitely be. So yeah, and cookies on telehealth makes sense. Nutrition quiz, again, that was my case study. So pretty much that's what I learned as well. Cool, awesome. Let me move back. Great. So kind of shifting gears here, wanted to kind of touch on the overall obligations that you as a company will face. And there are a few, right? So the first one is around transparency, right? So this law basically goes ahead and say, hey, you need to have a consumer health data privacy policy and the link on homepage, similar to the do not sell link. you need to have another link for My Health, My Data, which is basically a consumer health privacy policy link. And then it goes into defining what all has to be part of it. So it needs to have things like what are the type of health data, what are the sources of collection of that health data, the types of third parties this health data is being shared with, what actual health data is being shared with these third parties, right? So from a transparency perspective, I feel it's really pushing the boundary and saying, hey, be really transparent and put all of this information right on your homepage so that your consumers know. There's also carve out for the same processors. So the third party which will fall under processors, you need to have the contracts change and add. There are some obligations that you need to add so that they are respecting or they're processing health data on your behalf, and there are security considerations as well. What I found really interesting and very different was the data lifecycle restrictions. So the first one that I saw, which is very similar to GDPR, was purpose limitation, where if you are collecting consumer health data and you start to use it for a different purpose, you pretty much need to inform the user, and I think take consent as well. Collection of data, sharing of data, selling of data, all of this very, very specifically defined. So Mohsin, would love to kind of look from your perspective, right? Like the use of data changes, and that was something that people used to always say, hey, let's collect everything and then we'll figure out the use later. I mean, how do we change, and how do we think about this limitations that have been put under the law?
Yeah, absolutely. And in this context, really, you're going to have to jump into the mindset of a healthcare entity where, you have to have an opt-in essentially for any collection, use, and disclosure of data other than for what is necessary for providing the consumer requested product or service. So in healthcare, obviously, if you're providing, care to the individual, you're allowed to use information, but for everything else, you generally do need to collect that consent. And that's kind of similar here in this context. And that's going to create issues because, again, obtaining all those consents, on the front end for individuals, and then also when you're trying to share or sell it in the context of certain parameters, because you need it for sharing purposes and aspects, you're going to have to collect a secondary consent. So you're looking at, a consumer or an individual being presented with multiple opt-ins that can be confusing, also create friction around obtaining that because they get frustrated because they're like, didn't I just sign something 5 seconds ago? But also on the company side, where you are collecting all of this information, you then have to manage the consent. You have to make sure, what did they consent to? Where are they consenting it for long? For how long are they consenting it for? For what purpose? And those are going to create obligatory frameworks that create additional administrative hurdles that will have to be planned for, but be also utilized. Your example of, hey, collect everything and we'll figure out what to do with it later. Well, unless your original opt-in consent is saying we can do anything we want with this data, it's going to be very hard for you to do anything with that data because, again, you're not collecting with the right purpose in mind. If you're collecting data and the consumer says, yes, you can use it for, selling a product to me, great, but that's all you can use it for. You cannot then turn around and say, we're going to, we know you bought this, so we're going to market you something similar in the future, unless you collect a consent that focuses on that aspect. Your allergy medication is a prime example of that, right? Like if you bought allergy medication one time and the consent says, we can only use it for this purpose, well, you can't turn around and tell them, hey, we have similar allergy medication on sale, we know you bought it in the past. That's going to create friction on everybody. But I know as a data entity, we collect all of this data. We're used to collecting all of this data and then figuring out later what to do with it. Well, this is going to create a huge problem with that.
Yeah, and from my understanding, I think a big change would be to really look at how this changes over time and how can you have enough privacy checks before these new changes that could introduce a new third party, add a new data flow, re-architect, all of that I think that's like a big change because that was not being done earlier. There's the consumer rights, I would say especially if you have complied with CPRA or the other laws that are coming up, I think that pretty much is kind of still on the same wheelhouse. But geofencing I found, Mohsin, was pretty, different. That's the first time I actually read the term geofencing as part of a law. So I actually wanted to get your perspective on what that really means and who could it impact or what's the rationale. I know we touched upon it as well in the last couple of slides, but what's your thought on geofencing?
Right, and I think one thing to keep in mind is, again, I keep coming back to our earlier comment on what the reasoning or how it was sold politically was that, it's a response. And that was one of the responses was there was use of geofencing data to identify individuals who are going to certain services and obtaining those services in that context because other aspects were prohibited. This is one of the first, I would refrain from that, let me reword that. This is one of the most aggressive around protection of geolocation data for non-healthcare entities. So healthcare consumer entities, as well as apps, trackers, phones, anything that utilizes information around precise location is restricted around certain healthcare services. Combine that with a broad healthcare service definition, you have two very, it can lead to a very onerous obligation on entities that collect it. You may be fine collecting information relating to the laundromat, but next door might be a clinic, and you might not be fine collecting information on that. And consumer might go to both, and you're going to have to figure out a way to either blind that data, not collect it, or auto turn off, or a number of different ways in that context.
Yeah, that makes, and essentially, like, there's always a way to get out of it, right? Like, if you don't need precise location, if you can do with coarse location, maybe that's the best idea, and that could save a lot of headaches as well. So yeah, I think like it all is kind of seeming and on the same principles of data minimization. And okay, do we really need this precise location? Because it's very easy to get that. I mean, you add that permission in Android, and the user approves it, and then you start to get it. But then the headache increases later because of all of this. So I think that was super helpful. And kind of shifting gears, right? In terms of kind of the law is broad. We kind of went into what consumer health data, what the obligations are, but I really wanted to kind of use your expertise as well, Mohsin, in terms of how do we like comply, right? And I mean, the way we think is like the first phase is the same, right? Data mapping, discovery, just kind of knowing what's there, right? Like rather than worrying about the known unknowns, can we like get a good understanding of the known knowns? What do we do today, right? So from a collection standpoint, right? Like if you have a mobile app, if you have a website, if you have a clinical app, if you have a web portal, a phone system, like a CRM, all of these places which are directly interacting with your consumers, what's the data that you are collecting there? Taking that and classifying that into these consumer health data types, I think that becomes very crucial. And also like looking at precise location. Does your app collect precise location, or are you collecting GPS? And that too continuously. If it's continuous, very high chance that you could actually be in a place where someone is visiting a hospital. Partnership. So if you are buying data, does that have any impact? If you are a processor, then you might be anyways be getting consumer health data. So looking at that as well, right? So from a collection standpoint, going back to all these systems which would collect data, a lot of them would be digital. Programmatically, you might be collecting tons of data, and classifying and discovering at those sources will be super important. From a sharing and selling perspective, right? Like discovering all the third parties. And once we go into the ecosystem of third parties in mobile apps, you will see there are so many SDKs, APIs, pixels. You might be doing like offline sharing, you might be selling data as well. So having a list of third parties which are integrated in your products, both on the front end of your mobile apps and also on the back end of your machine learning analytics system, and then categorizing what is sharing, what is selling, who are our processes will be crucial. Once you kind of have these two things, the data you are collecting and your third parties, then bridging the gap of saying, okay, we now want to also know what is our data flow. So which third party is actually getting what consumer health data would become super important. I would say, like, again, this is something we touched, but like looking at if you have an analytics system, they are notorious to automatically collect data. They will collect data of page names, clicks, search queries, and all of that could leak consumer health data very easily. And finally, also like marketing channels, right? So your marketing team would end up creating lists on Facebook, LinkedIn, TikTok, Snapchat. Do these lists have been derived from some usage of certain consumer health data, right? So that also becomes important. So that's kind of the first phase that we look at is, hey, how do you reach a point where you know what you're collecting, who you're sharing and selling it with, becomes kind of the baseline. Mohsin, would love to know from you in terms of what your perspective is, and you've done a ton of work here as well. What works, what doesn't work?
Sure, absolutely. I mean, this is a struggle healthcare companies face constantly, right? Like the framework that you're applying here is very similar. One thing to keep in mind is you don't know how to comply if you don't know what you have, where you have it, how you've collected it, and what consent frameworks apply. In this context, it's the same exact thing, to be quite frank with you, because again, you have to make sure that, like you were touching earlier, we're in an area now that, we're collecting so much more data. Now with generative AI popping in, the utilization demand for data is just going to increase. And with that increase becomes, a desire, a marketing, internal audit, any number of functions that want to use that data for any number of internal purposes, as well as external purposes, whether targeting or growth or any other opportunity. The flex here, however, is the area that we got to be concerned about, is that these regulatory frameworks are coming in sometimes after the fact, and now really are being applied around after these systems have been created or in existence. And really, one of the only ways to kind of look at is going to do a deep dive, a data map exercise, privacy impact assessments on the front end, integrate them into your product life cycles, to continuously audit and make sure that, what you're being told is accurate, as well as making sure that you're having conversations with marketing, with engineering, with product to say, these are things we have to keep in mind. If you are going to collect data, let us create a consent, that is collected in a meaningful way. And let's make sure that any information that is collected is isolated so that we know what use we're doing it for. If we are sharing it, make sure that we're collecting it in a area that we can utilize and share with these entities in the context of any other further purpose that they need to do it for. Audience data on Facebook and all these other areas very easily can fall into the line of my health, my data. Hey, there's a Facebook group called Diabetics Association of Washington, and only diabetics are in there, or any number of other areas. Well, guess what? They're self-identifying, and it's similar in that aspect of it.
Yeah, no, exactly. I mean, and your point of not knowing and you can't comply if you don't know, I think that holds true for all privacy laws, including this one, especially this one, because you need to categorize, look at everything from a broad scope.
Right. Yeah. You might not think you need to comply, but the fact of the matter is you do need to comply. And with private right of action, as well as HE action, there's going to be aggressive attorneys targeting entities. We're already seeing at some level with CCPA, CPRA in that context. We're going to see that with this as well, because again, there's very little limits. And, when class action lawsuits start, this is going to be serious money we're talking about that's going to incentivize certain actions.
Makes sense. And then I just wanted to put from the last discovery data mapping exercise as you go in, specifically looking at mobile apps, and I put it broadly in two buckets. One is your trackers. This is where you need to be super serious about. This will be like Google, AdMob, Facebook ads, pixels of LinkedIn, Snapchat, Twitter, TikTok, also data brokers. So they are integrated generally to cross advertise. So looking at that becomes like one big bucket. And then there will be a big bucket of other third parties. And both buckets will be huge. So like analytics, you could have Firebase, Google Analytics, you could have Amplitude, Mixpanel. These are all third parties that your developers can very easily sign up and integrate in your products, in your apps. You will have some governance, I'm sure, from a control perspective. But as you start looking at these, you will be surprised to see how many third parties are integrated in a mobile app. It'll be at least, on the lower end, at least 15 to 20. That's what my experience has been. So yeah, that's kind of the first step. The next step is definitely remediation, right? Once you have this data map, how do you go from there to complying? So some general tips like making sure remove the unnecessary third parties. In my opinion, like if you can remove trackers and pixels, that reduces the risk significantly. You might not be able to do it, but the unnecessary one for sure, remove them. Looking at these data flows and saying, hey, today there is no consumer health data flowing to a tracker or a pixel. And if it is flowing, then you need to, if that is going to happen, then you need to have consent and get that selling obligation sorted. Looking at URLs, I think this is the most common way I've seen any data leaking is the URL parameters have drug names, appointments, and they get passed very seamlessly. So this is kind of very technical, but this is the easiest or the most common way I've seen how health data gets leaked. Of course, you'll have to create this consumer health data privacy based on the reality, based on the exercise you did in the last step, and update your contracts related to My Health, My Data Act with your processes as well. So that gives you like a good baseline of you start from a place where you get to all the discovery and all the data mapping done. Then from that, you can remediate and reach a point where you have complied. And finally, I think this becomes equally important is how do you comply from a prevention perspective? Because again, to go back, change of purposes, collection of new data, all of that required certain obligations. So like prevention is the cornerstone of compliance for this law specifically. And there are, in my view, there are two things you'll have to do. You'll have to implement some process and some technology as well. So from a process standpoint, as Mohsin, you also mentioned, right, like interfacing with the engineering team, marketing team, and training, in fact, then on whenever a new third party is added, what do you do when you're trying to do it? Audience data, collection of new health data. So having a good training for these things will be crucial, including a privacy review process as part of product lifecycle. The PIs, that will be super important as well. I would say you have a third-party risk management program already. If you are a medical app or a health app, if you have identified you have consumer health data, adding that section for my health, my data as part of that will be important. Mohsin, I think you wanted to add something.
Yeah, I was just going to comment. I think one thing to remember is that this regulation applies just as much to that solo developer as it does to that company of 1,000 people, right? Yep. So when we're talking about collection of data, it's not the fact that it won't apply because you're a small business or, you know, just a new developer. The way that it's currently phrased or written down is, yes, the smaller entities have 3 months longer to comply, really, at the end of the day. But the same regulations, same requirements apply across the spectrum. So it's important to build these ideally into the front end. And then for the later end, it's important to kind of be thoughtful about this in the context of on how you're doing this.
Completely agree. And the last part of prevention I like to see is basically partnering with your IT, DevOps, security team, and essentially making privacy more integrated in your product development lifecycle. One is via assessments, and that will cover a lot of ground from a new feature perspective, but also taking all of this disclosures that you've done, making it part as code check, something which is looking at, hey, a code has changed. Does this pass the bar of our disclosure? Are we collecting more data or not? You know, having a process where you can stop a new software change if consumer health data collection increases, or you add a new tracker, or you introduce a new health data flow, that'll be important. Overall, like going from a place where privacy is not part of software development lifecycle to a place where you add that break, that will be crucial, because remember, if you add the break here, you can actually innovate faster, because as privacy teams, you have a governance engine saying, if anything goes wrong, we have a break to stop that software change, which means our teams can innovate faster. You know, because there's someone which is checking, or some automatic way there is a check of, you know, a new tracker or a new third party, right? Also, it enables continuous assurance and auditability, right? So kind of, again, like summarizing from a perspective, and this is kind of where Privado also helps you, is essentially we cover all three phases of discovery, remediation, and prevention for you. So once we integrate inside your company, we'll scan all of your products that your engineering teams have built, automatically discover and classify health data, identify all the collection points and sources of data, discover any third party which is integrated, be it on the front end, be it on the back end, be it via an API, be it via Pixel, anything. And then also build this global view of data flows on the consumer health data, how it is collecting and where it is flowing to your internal system. So you can manage a consumer health rights request externally to third parties as well. So across the ecosystem, you get the discovery automated using our code scan, using our product scan. The second is, from a remediation perspective, we also open up privacy issues saying, hey, you have health data going to a Pixel, and that goes into the queue of your engineers to fix it. We also enable like seamless collaboration, so well integrated with where your product and developer teams will spend time, Jira, Slack, GitHub. And also empower and help you create a dynamic consumer health privacy policy, which means tomorrow, if like your cookies change, your cookie notice changes. Similarly, if you start to collect more health data, that privacy policy is dynamic enough to change automatically. And then the last leg of prevention, right? So I'm like super passionate about this part, is like, how can you add the breaks as part of your software development lifecycle so that you can innovate faster? And Privado enables you to do that. So taking your consumer health privacy policy, creating rules around that. So in case you say you only collect 5 health data type and a 6th one pops up, something that will get reviewed and only when approved will go live. You know, if a new tracker gets added, we will prevent that change from going live. And all of this combined essentially helps you make both the training component just in time. So if an engineer adds a new tracker, you give the guidance and the training right then, and also give you a continuous assurance and auditability as well. So that's what we do. And I know we have 10 minutes left, so I'll quickly give you a demo and open it up for Q&A. Great. So, Mohsin, can you see the dashboard?
I can, yes.
Yep. Awesome. So I have a bunch of these health app scans. So I'm going to use an example of this health app called Health Me. Essentially it has, this is kind of the data flow diagram for it. It has some collection point. There is some third party called Google AdMob. some API connection. So this is kind of the data flow diagram and a lot of data elements being collected as well. So we're going to go ahead and see the first part, which is discovery. So first of all, what we've done is imagine this is your mobile app. You run a scan on that and discovered all the data types it is collecting, including health data. And I'm going to focus on health data for now. So for example, in this specific product, you have mental health, disability, heart rate monitoring. These are 3 health data types which are being collected. And there are also data flows to Google Ad Map. So for example, if I look at heart rate monitoring, this is the data flow. So it's being collected using 2 points and it's flowing to Google Ad Map. That's basically pretty much selling or sharing, one of those, how it gets interpreted. So the benefit that you get with Privado is essentially once we run a scan on your mobile app, on your website, on anything which is happening in your backend, we build this, we discover data, categorize it into health data, and build this large data flow diagram. Once you have this picture, it helps you have the first story sorted, which is the discovery engine, right? You know your data maps, you know what data you're collecting and where it is flowing. The second part is we also open these issues for you. Now, issues for you is, hey, the way you have this health data, this mental health data, that is leaking to logs or that is being shared with Google AdMob, and that is a problem. So going from a place where you don't know what is wrong in your product to a place where it is automatically opening up issues and saying, if you fix these 10 things, your product will comply with My Health, My Data Act is what we enable. So you go from a place of discovery on what the data is, what the data flow is, you build your inventory, and we also open up issues for you to collaborate with engineering to resolve it. And then finally, all of this becomes part of your product development lifecycle so that these issues are not only removed from production, what is live today, but they never return. So I know it was a super rushed up demo. Happy to do a demo later as well. But yeah, I think we had a lot to chat about as well in terms of what the law is, right? So yeah, let me just open up quickly on Q&A. There are actually 2 questions. Both of them are super interesting. The first one is, Mohsin, for the hospitality industry, would you consider wellness rooms booked in scope for My Health, My Data? That goes back to our discussion of the broadness. What do you think?
Right. And that goes back into the discussion of, the broad interpretation of what the rule is. And that also talks about, broad interpretation of what a wellness room is really at the end of the day, right? It could be anything from exercise room, and it could just be that, or it could be a number of other items in there as well. So the key area to remember, though, is that if it's by itself, potentially, if it's combined with other different metrics that you're pulling in, then you're definitely kind of running into that, more it's more likely to be consumer health information. So maybe, I guess right now is the best answer without additional information. Sorry to give the legal answer, but that's what it is.
Yeah, and that's kind of, again, in my opinion, that's the example of the known unknown. But yeah, I mean, if you definitely are in the wellness space and you are going to anyways collect it and not hospitality, then you focus on the known knowns. You already know some data that you're collecting. So
absolutely.
And then the second one is, do you think that companies that do business in multiple or all states will have a practical way to limit these obligations to only apply to Washington residents, or will they have to apply requirements to everything because there's no practical way to limit the scope to only Washington consumers? So kind of like, hey, can we only give these to Washington residents, or is it like I need to build it for everyone and can't scope it out?
No, that's a great question. And that's something that a lot of privacy professionals have been kind of struggling with, because again, you see all various different states create their own regulations. Connecticut came out with theirs just recently. Virginia's got theirs. Colorado's, just to name a few in that context. You could take the approach of, this is the most conservative approach, but even when you look at these regulatory frameworks, some of them conflict with each other. So you could try to comply with it by saying all of them, but at the same time, you're going to raise some issue in this context. There might be some federal preemption now coming, potentially, because we're seeing this disjointed framework. I think there's more of a conversation around these various frameworks creating additional redundancies as well as conflicts for businesses, and you might see some action in this context. I think this is something a business has to decide internally with themselves, with the conversation with their internal stakeholders, privacy professionals, as well as designs, because these create different obligations. Because if you start running down saying, hey, everybody now has this right, you might be handcuffing yourself in various different areas because of your market exposure to, say, the state of Washington or anything else in that context.
Makes sense. And I would assume like there are some things which are easier to garden off, like maybe the consumer health rights request,
Sure.
you can garden that off or say only for Washington residents. But when it comes to data flows, I mean, like once the app is made and you started to collect data and that data is flowing to, a specific third party, I would imagine that would be super tough to say, oh,
Yeah.
this flow of data happening via our product, we will only, we will not have this for Washington residents. I mean, you can do it with IP, but then you're collecting more data actually on the same resident. So yeah,
Yeah.
maybe some of them might be easier. Some of it will definitely be tough. All right, awesome. So I think these were the questions in case anything comes up. But I definitely want to thank everyone who joins. Thanks, Mohsin, for explaining patiently. I know the law, we'll get a lot of guidance. I'm hoping we get a lot of guidance as the date approaches. But
Yep.
thanks for all the insights and thanks everyone for joining in today.